Times Square's annual New Year's Eve celebration has been scaled back. Just 15,000 guests are invited to the event. Normally it's about, well, 4 times that amount. Is 15,000 too many in these current circumstances? Here's the thing. If you're planning on ringing in the new year at a major party, Dr. Anthony Fauci says you better think twice. Virus cases jumped 60%, and that's just in the last week alone, folks. No signs of letting up. Earlier, I spoke with our D.C. correspondent, Bofta Yimam, on what you need to know as you make plans to ring in the new year.
Now, meanwhile, New York City has imposed a capacity limit of 15,000 people at Times Square for their big event, saying that everyone needs to be vaxxed. But London, Paris, Rome, they have called off their events completely. Early data showing those who are vaccinated, and especially those who are boosted, are likely to have mild or asymptomatic infections. So folks who are planning to go out, the big advice that Dr. Fauci has right now, Sharon, is look, make sure you're vaccinated and boosted with close family and friends if you decide to hang out on New Year's Eve. If you're anything like me, you'll probably keep it even smaller than that because don't want to have any risks associated with my New Year's Eve.
Yeah, no risk at all. And if more people were like you, we might not be in this problem, Bofta. We do know Dr. Rochelle Walensky is defending the CDC's decision to cut the isolation period in half from 5 days to 10 if you're asymptomatic. At the end of that period, the guidelines suggest. But some are skeptical about this. And speaking out about it, walk us through that decision.
Well, look, I think culture and the way Americans have been during this pandemic has played a large role in their decision. The CDC making this move, announcing it earlier this week, caught a lot of folks off guard. Union leaders, health experts were really raising their eyebrows and pushing back against this, really questioning whether business leaders who were hailing this decision were really the ones pushing this decision. But they said it's based on when people are most infectious. And that is most transmissions happen 1 to 2 days before the onset of symptoms, then 2 to 3 days afterwards. And the CDC's move also was spurred by worries that the surge could lead to a breakdown in essential services like police officers and firefighters. Still, again, the move has received quite a bit of pushback, saying the CDC should require a negative test to end isolation, and others pointing out that the guidance seemed more aligned with business interests than public health. Take a listen to Dr. Walensky here.
It really had a lot to do with what we thought people would be able to tolerate. We have seen relatively low rates of isolation for all of this pandemic. Some science has demonstrated less than a third of people are isolating when they need to. And so we really want to make sure that we had guidance in this moment where we were going to have a lot of disease that could be adhered to, that people were willing to adhere to, and that spoke specifically to when people were maximally infectious. So it really spoke to both behaviors as well as what people were able to do.
Americans are waiting too long. I described it as the Hunger Games, and I really mean it. Personally, I've been traveling during the holiday, and I've had to just rush in store after store after store to try to find the test, exposing myself to people who might be infected with this virus. It's not where we should be going into year 3 of this pandemic, and the Biden administration can do a lot more.
Now, the president has said he is not looking at lockdowns, but we've seen that businesses have been hit so hard, industries have been hit so hard, like the airlines, that essentially it's not quite a lockdown, but we are seeing, a disruption to our society. Folks, 1,000 flights canceled just this morning, I think I heard earlier. So we know that it's been a huge disruption. So he's not calling for a lockdown, but it certainly looks like it's headed in that direction unless something major changes.
Yeah, but, it's the messaging. Isn't it always the messaging? If you tell people the truth, I think you'll be all right. You'll do right by them, and they'll trust you. But this mixed messaging, and just because you use the word science both over and over again, it doesn't make it true. Maybe partially true in this case.
Yeah. And Sharon, just to add, the switch up so close to celebrations, I think, is what builds distrust. As people have already made plans, and then they're watching, have no rapid test. Is it because of this? And the CDC pushing back against that. And they're saying, no, this is not because we don't have rapid tests. That is not the reason why we changed our minds about how we do this isolation and quarantine period. But it's hard for people to trust when the messaging switches up, and abruptly, I might add.